Mr. Mayor, we are live and ready when you are.
Okay. Meeting come to order. Regular council meeting, City of Soda, Monday, July 13th, 2020, 6 p.m. Roll call, please.
Mr. Morrison,
Here.
Ms. Rojas,
Here.
Mr. Nathan,
Here.
Ms. Sweat. Here. Mr. Colberg,
Here.
Mr. Campbell.
Here.
We have a
Joining
quorum.
in the pledge of allegiance, please. Gonna bring the flag up, Heidi. I pledge allegiance to the flag
This flag.
of the United States of America and to the republic for which it
Republic for
stands,
which it stands,
one nation,
one nation, under God,
indivisible,
indivisible,
With liberty and justice for all.
liberty and justice for all.
Excused absence, we have none. Agenda approval.
I'll make a motion that we approve tonight's agenda of July 13th, 2020.
Second,
All's in favor, Morrison,
Aye.
Ross,
Aye.
Nathan,
Aye.
Sweat,
aye.
Colberg,
Aye.
Campbell.
Aye.
Consent agenda. Heidi, you want to do that?
Yes, thank you, Mr. Mayor. For this evening's consent agenda consists of the minutes of the regular meeting, June 22nd, 2020, which is in laydown, and ordinance 21-01, an ordinance of the City Council of the City of Seldovia, Alaska, amending section 2.32150 absentee voting.
A motion to approve.
I'll make a motion to approve the consent agenda.
Second.
All those in favor, Morrison,
Aye.
Ross,
Aye.
Nathan,
Aye.
Sweat,
Aye.
Colberg,
Aye.
Campbell.
Aye.
Mayor proclamations done. Public presentation prior notice. Dr. Zink is on the line.
Mr. Mayor, it looks like she hasn't had a chance to join us yet. I know they were having a press conference at 5, so we'll just continue on and see if she's able to join us when she's able to after that's done.
Okay. Public presentations for items not on agenda. Anybody from the public? Hearing none. Committee and advisory board reports. Any board reports? Hearing none. Public hearing, resolution 21-01, a resolution of the City Council of the City of Seldovia, Alaska, reestablishing a small business relief grant program, utilizing funds from the Coronavirus and Relief the Economic Security Cars Act. Presentation, Cassidy.
Yeah, thank you, Mr. Mayor. Starting on page 9 of your packet is the resolution 21-01 that just establishes the small business relief grant program that we've been talking about for the last about 6 weeks. It is the grant program. The grant program itself is included in the packet, and there were no changes that have been made since the last meeting. We did develop a score and criteria sheet, and that is on pages 20 and 21 of the packet. That just gives a real simple score of 1 through 5, 5 being the highest possible points for the applicant, justifications for each of those 5 criteria, the total points awarded at the end. We felt that While we want to make this process as easy and seamless as possible, to have a simple evaluation score sheet for the review committee will be helpful in us facilitating and processing those applications. At this time, I would like to ask if there's any council members, preferably 2, that would be interested in being on that review committee.
Cassidy,
Yes, go
Yes.
ahead.
can I be on it?
I would love for you to be on it, Bobby.
Then I would like to be on it.
Okay.
If nobody else wants to be on it, I'll be on it,
I got 2
or I
takers.
could be an alternate.
Okay. John.
How many,
Cooper, Bobby
how many
Swift.
do you need, Cassidy?
I was just hoping for 2. If you're interested in it, George, you can also be a part of it and be a part of that process if you'd like.
Yes, I would.
I'll take 3. I'll take 3. Okay. Bidding's closed. I got Bobby, George, and John.
Okay.
Thank you for that. But I do feel really positive about the program that we put together. And I'm hoping that to get with Heidi a little bit on rolling out the advertising and just getting it notifications throughout the community and kind of doing a little campaign to make sure that the businesses know that this is an opportunity for them to apply for some business financial relief during this hard time. We realize that it's not going to fix everything and make every business whole, but we hope that every little bit will help. And what I'm also doing is I'm evaluating the total CARES Act expenditures. Right now we have 30,000 set aside for this grant program, but I'm hoping that we'll be able to set aside a little bit more for that program, and I'll give you an update at the July 27th meeting, what that final number is. The applications and the eligibility, it'll open up hopefully by the end of this week, and it'll go through September 1st. So we'll have a little bit over 6 weeks for businesses to apply. It is, it's just because you apply, you're not going to get the financial, you're not guaranteed to get a grant, but we're hoping that we'll be able to help a large number of the businesses that are in town right now that are having experiencing negative impacts of COVID-19. So I'll answer questions. Otherwise, you guys are good to move to hopefully approve.
Okay, we'll go to council. Council discussion or comments, and please get your thoughts together. Each council member has 2 times to make comments, no more, so we don't drag this out. Okay, any council comments?
Mr. Mayor?
Yes, go ahead, Vivian.
Yes, I'll be in full support of the resolution, and my compliments to the staff for getting it together, and also the criteria and the scoring system. Nice job. So I am just stating I'm in full support. Thank you.
Thank you. Anyone else?
Yeah, Mr. Mayor.
Go ahead, Jimmy.
Yep, I echo Vivian's sentiments there. I spoke in favor of it last time. I think it's a good program. I think it's appropriate given the times. I think it's well thought out. It's the scoring criteria. It puts it basically big and small, everyone in the same boat. So I like the way that it's getting rolled out here, and I'll definitely be in support. Thank you.
Thank you. Anyone else? If there's no one else, we'll move to public comments. Anybody from the public want to make comment on this issue? Hearing none, we'll close public comment. What is your wishes, council?
I'll make a motion that we accept resolution 21-01.
I second it.
Second.
All in favor, Morrison,
Aye.
Rojas,
Aye.
Nathan,
Aye.
Swett,
Aye.
Colberg,
Aye.
Campbell.
Aye.
Motion passes. Unfinished business, none. New business discussion. City of Sedalia, COVID-19 thresholds of risk management and mitigation. Cassidy?
Yeah, Mr. Mayor, on page 22 is a memo about us, the city of Sedavia's mitigation response and management of COVID-19. There's a couple of broad questions that I wanted to pose to the council, but before I do that, I'll just point you in the direction of the thresholds of risk kind of developed document that we put together starting on page 24. It's a document and a plan that can guide us through the different stages in case there is different stages of COVID-19 from lowest to highest. So we don't have any documented cases as of today. But in case that changes, this will lead us through different kind of different stages of that response. And I wanted to, number one, make sure that I am gauging the city council's expectations when it comes to the management of COVID-19 for Seldovia, and just to make sure that we are aligned in that regard. You guys are elected officials, and I want to make sure that your constituents are expressing that they are happy with these plans that have been put together over the last 4 months. And if we're all on the same page, I think together we will be able to successfully go through this pandemic. And I just wanted to kind of open up the discussion of making sure that your expectations are being met of the administration and of our emergency mitigation team in terms of how we're preparing, how we're planning, and how we're implementing those plans in the community.
Okay, council comments, questions?
Mr. Mayor?
Yeah, go ahead, John.
Yeah, I'm reading down on here, and for myself, I prefer the administration plan proactively. I would rather try and stay ahead of COVID-19 versus playing catch up all the time. So I'm kind of proactive about it. Thank you.
Thank you, John. Anybody else?
Mr.
Yeah,
Mayor.
I have something.
ahead,
I
Barbara.
fully support Cassidy on this. I agree with John. I think we need to have a plan. No matter how, I don't know what the word is I want to use. I guess the plan is not going to satisfy everybody. Everybody's not going to be happy with it. But I think Cassidy's got a responsibility to the community to protect it as well as she can. Plus, she also is being guided by what the state mandates are. She's not like she's coming up with anything weird or out of the ordinary or whatever you want to call it. I think it's a well thought out plan. My gosh, I could never do something like that, nor would I want to. It's amazing. And you have my full support, Cassidy. I'm happy that you're trying to keep the community as safe as you can. And, we'll just have to deal with whatever comes along. Thank you.
Thank you, Bobby. Anybody else?
Yeah, Mr. Mayor, if I may.
Go ahead, Vivian.
Yeah, I'm in full support of what we've been doing up to this point, and proactive is definitely the course we should be going on. And I think the people who I spoke to in the community constituents are all in favor. I haven't had anyone complain to me about what the city has done, what they've, our plan of reopening and what we've chosen to do. If anything, it's been in support. So I'm in full support of what we've got going and staying on top of it in a proactive manner. And I think we're doing an excellent job moving forward. So I'm in full support. Thank you.
Thank you. Anyone else?
Yeah, Mr. Mayor.
Yes, go ahead.
Yeah, Cassidy, I also have not heard any opposition to things we've been doing up to now. I think you've got a real good program there, and I think you'll have plenty of community support for it.
Anyone else?
Yeah, Mr. Mayor.
Okay, go ahead, Jeremy.
Yep. So yeah, obviously, I mean, I'm gonna be in support of this. It's a, there's a fine line to all this. It's a big one giant balancing act that I think most administrations throughout the state have had to do. And I think, I mean, looking at what you guys have done, Cassidy, and what every community is a little bit different, but I think what we're doing in Seldovia is appropriate. Regardless, I know what Bobby was trying to say, regardless of, we all have personal feelings about this, and it gets heated. It gets very heated. I've been in some horrible arguments with people about this, and I think there's a lot of people that feel very strongly one way or another. But I think, as an elected official and people that are in charge of trying to keep our city safe, I think we have to take probably a little more cautious approach than even some of us feel about this whole thing. So, I mean, I'm definitely in support of what we have going on here. I don't think there's nothing over the top about this. I think it's very consistent with what the state's doing. And at this point, regardless whether or not we agree with everything, I mean, it's the responsible thing to do when you're talking, hundreds and thousands of people trying to, control a pandemic to the best of our ability. So I applaud what you've done here, and yeah, I think it's totally appropriate for what we're doing. And the same thing, I mean, people complain, but I haven't had anybody come up to me and specifically say that they're super pissed off of what's going on, with the city and how it's being managed in terms of the pandemic. I think it's appropriate what's happened happening given the times. So I'm definitely in support, and thank you for your efforts.
Thank you. Anyone else? If not, we'll go to public comments. Anyone from the public care to comment on this issue? Hearing none, we'll close public comment. What are your wishes, council?
This is just discussion.
Yes. Yeah, that's just discussion.
It's
So
just
we'll-
discussion, and I will double check, and Heidi, maybe you can give me an assist right now for the not resilience plan, the threshold of risk plan. Do they need to approve that? And if so, shall we draft a resolution for that?
I apologize. I'll have to look into that, but I do believe that a resolution is always good to have that legislative paperwork behind it. And we can bring that back at the next meeting.
Okay.
But if they wanted to make a motion approving it now, just so it's that step forward, that's always good to have too, just in case we need it at this point.
Does anybody want to make a motion?
I'll make a motion that the city council moves forward with the city of Seldovia's COVID-19 thresholds of risk management and mitigation.
I'll
Seconded.
second.
All those in favor, Morrison,
Aye.
Ross,
Aye.
Nathan,
Aye.
Sweat,
Aye.
Colberg,
Aye.
Campbell,
Aye, sorry about that.
Motion passes. Discussion of police position and job description. Cassidy?
Yeah, thank you, Mr. Mayor.
We missed a place there, didn't we?
Yeah, we
Discuss-
skipped two.
Policy,
I'm sorry.
Item 2.
Discussion, policy of events and gatherings of municipal property during COVID-19 epidemic. Cassidy?
Yep, so this is a policy that we've put together. We've talked about, use events happening on city properties often over the last 18 months or so. It's come up in various discussions. And now that we are in the midst of a pandemic, I think that a little bit more a solid policy that is a little bit more laid out would help the administration and the city make sure that events that are happening on city property are happening responsibly and with the protective measures that are related to COVID-19 are in place. We have rental permits for spaces that individuals and businesses and groups can rent. But we don't have a permit process for events. And we talked about this last year with the, I think it came up during the chainsaw carving, and bottom line, it would just make things administratively on this end be a little bit more clear cut when we come up with discussions on events. Don't mean to put salt in any wounds, but for instance, the 4th of July, I feel like if we had a clear, more distinct permit process for those types of events, it could have created a clear communication, clearer information, and have those policies been developed, then maybe we would have a different outcome right now. So moving forward, I think it's prudent that we put policies in place that are making sure that the events are held responsibly as it relates to COVID-19. The memo is beginning on page 33. And I'd just like a discussion based on the purpose, the applicability, and what that document looks like.
Council comments?
I have a question. In the permitting process, we come up with a permitting process. Can they have a part in there that pertains to public health, public safety? If there's any risk to that, what the risk to that is. It's like during this COVID thing, that would definitely be in that category. But if something else came up later, it could be dealt with the same.
Yeah, and is that part of this policy is specific to COVID-19 and mitigation and management efforts that we would be expecting from the organizers or the user groups on our public properties. If you want to begin having a permit process plus or minus COVID-19, in place, that is a city permitting process. We can go down that road too. We didn't take it that far based on our previous discussions prior to COVID-19. We had brought it up, and it was something that I think that the consensus of the council was that it wasn't something that was necessarily needed in our community.
Yeah, this may be a once in a lifetime thing. I don't know, but they could have something else pop up in 2 years, 3 years. So I was wondering if a way to get that in to where if something does come up, it's in place already.
Mr. Mayor, if I may.
Go ahead.
Yeah, I think this is a great forum for addressing permitting processes on city facilities and city property during the COVID. But I also would like to, and my mistake, I meant to bring up, I would like to see the city actually come up with a permitting process. That's something that's come up through the years. And so maybe on that draft, John, maybe in that draft, we could
Yeah.
come up with your concerns. But I would like, so actually I could request to the city clerk that maybe on our next agenda, but maybe I'll talk to the city office, we could come up with a process for something that is generic application permitting. But I think this is a great document addressing what we have going on right now. Thank you.
Yeah, definitely.
Anybody else?
Yeah, I have a comment. I agree with Vivian. I think, right, for what's happening right now, and again, following the state and the CDC, I think this plan is for public gatherings follows the guidelines. There's nothing crazy or nothing weird about it. So I think you did a good job, Cassidy and Heidi. I'm in support of this.
Thank you. Anybody else?
Mr. Mayor,
Yes, go ahead, George.
what other sorts of events are we contemplating permitting? It seems that what we have right now is a specific set of rules for a specific situation. And I kind of hate to see one size fits all. Maybe we should think more about another process. I mean, when we come to something with a problem, we can do the same thing we've done for this. Again, Vivian, if you could just answer what sort of events you're thinking about when you're talking about a general permit.
Yeah, Mr. Mayor, if I may.
Go ahead, Vivian.
Yeah, yeah, George, in the past, we've had issues with even like the 4th of July celebration last year and the Seldovia, the SOC, the Art Council. There's many, and I'm trying to think who else we had in the past who would come and ask to do, the carving, a different, whatever group that, the chamber. So between the different entities, they come to the city and ask them, and it's always been kind of at the question came to the city office and they had to kind of make the choice and the decision there instead of there being a permitting process. So because it came to and I think maybe once, or I think last year, maybe it did come to the council and we didn't go anywhere with the permitting process. So I think it would eliminate, I mean, we're working towards eliminating issues that go through the city office and streamlining. And so for me, it's more of a streamlining of a procedure that should be in effect. So just like anything else that goes to the city office, it should be streamlined, be able to come in and say, well, here's the application, here's what we're doing. And it's won't be that big of a deal as long as there's nothing extraordinary or out of the way that the city has to be concerned about. So there has been things in the past. Chamber, and maybe Cassie, you can chirp in here also. The chamber, the Art Council, the Seldovia Recreational Service Area, and what other entities can you think of, Cassidy?
When they do the
There
New
was
Year.
a fun
for
run.
the fireworks.
One specific incident was
yeah.
there was a fun run last year where there were no permittings, but they had blocked off parts of a right of way where the runners were coming in and out. And we had received several complaints about the flow of traffic being blocked and people not being able to get in and out and whether there was permits issued. And we had no idea what was going on.
Right.
Organized events it would be helpful if we did know that they were going on, not just to make sure that we have responses and have some type of assurances from the organizers, but in addition, we could have had Chief Cushman be, directing traffic and making sure that there were cones available or anything like that. So from a safety standpoint, I think it's important that we are aware if there's 50 people running down Main Street, That'd be kind of,
That's a perfect example. And that one slipped my mind, and I was actually involved with that run. So that was a biggie. And there's times that people ask, you feel kind of silly when somebody asks you, oh, what is the city sponsoring such and such run? You go, gee, I don't know anything about it. So if there were a permitting process, we would all be abreast of, the city would. And so I think it's a great process just to simplify and make sure there's not any issues that come up afterwards. Thank you, Mr. Mayor.
Anyone else?
Yeah, Mr. Mayor, I have a comment.
Go ahead. Norma.
I agree. I think the permitting thing is probably, it's part of this, but it's also totally appropriate for it to be its own separate agenda item, at a later follow-on date, based on the discussion we're hearing here. But in terms of what's before us, the policy for events and social gatherings, during the COVID-19 pandemic. Obviously I got outvoted on this last time, and I'd probably get outvoted again. But, in light of the previous discussion, I understand the position that the city's in terms of, being extra cautious on stuff like this. My concern, because it happened on the 4th of July, is I don't want to, if the city chooses to be more restrictive on their property, what I don't want is to create or exacerbate a problem where we're pitting businesses against the city. There's a lot of pretty upset people last time because I think that whole process got torpedoed and it wasn't the outcome I was expecting about the 4th of July. In the end, all the businesses stepped up, did what they had to do. But the city and the businesses need to be a partnership, not at odds with each other. We're too small of a town to do that. So I guess it's just recognizing the position that the city's in. And then, if businesses choose to go forward, with events, they definitely should, not be chastised or, criticized, by people for moving forward on that. Again, everybody has to assess their own personal risk. And if they choose not to participate in those activities, then that's fine. But there's just as many people that do want to participate. So I just want to throw that out there. And I think that needs to be said and recognized. So other than that, I obviously I'm going to be in support of what's in front of us and, on the cautious approach that the city's taking on this. So that's all I have. Thanks.
Thank you.
Mr. Mayor?
Yes, go ahead.
It looks like we have Dr. Ann Zink was able to join the line with us this evening. If the council wanted to suspend the rules and go ahead and allow that question and answer discussion to take place so we don't take up too much of Dr. Zink's time.
Yeah, we can go ahead with that. Thank you. Dr. Zink, are you there?
I am. Thank you, Mayor. Dr. Ann Zink, I apologize to all of you for being so late. We had a press conference with the governor and there were lots of questions, so it took a long time. So sorry to zoom over from one thing to the next. And it's just a real honor and a privilege. I've been watching the stuff that has been coming out of your community that has been creative and insightful and fun-loving since the absolute beginning. And I love being able to be included in these conversations because I get to hear what Alaskans are thinking directly. So I'm happy to provide any information that would be helpful to you all, or happy to take any questions.
Any questions for Dr. Zink, council?
Well, I have a question. I would like to know, in your professional medical opinion, how do you think as a community we are handling the mitigation plan we have in place for COVID-19?
That is a great question. I think from a medical perspective, I think that first of all, a pandemic is really hard. We haven't had one probably like this in 100 years, and we're all finding ways to learn about this virus and being able to respond to it in new and creative ways. My impression of what your community has been doing has been keeping up with the science and data, making changes in response to it. but making sure that it is, again, having people work together in a data-driven response that takes all of us. I think this disease, again, highlights to me on a daily basis how incredibly interconnected we are. I think that we are learning on a daily basis new things about this disease and this process. And in general, I think we have a lot to be proud of in Alaska and in your community, and Sylvia particularly, in your ability to respond creatively and collectively with kindness to their response. But happy to dive into more questions or specifics if there was something I left off.
Thank
Mr.
you.
I'm sorry, Vivian, did you have a question?
Yes, please. Yes, thank you for joining us, Dr. Zink. As far, what recommendations would you give to the community? We have been very fortunate in that we have had no cases. We do have an isolated community. We do have a lot of, it seemed to me, a lot of Alaskans traveling through, flying in, boating in. So what would you give a recommendation to a community about how to keep COVID out? What can we be doing? We are doing what we can be doing, but what is your golden rule? What can you tell us that we need to reaffirm with our community about how to keep safe?
This is a great question. So maybe I'll start off with it in general, but then ask you guys where you feel like the bigger challenges have been in your community, because you know your way that I don't. I think 3 C's all the time. So close contact, confined spaces, crowded places with lots of people. Those are our 3 ways that we really escalate this disease. And so the more we can have things outside, spread apart, are going to be how we could take it from having no cases. And if you happen to get one traveler in who has it, you don't suddenly have 30 cases or 40 cases in a short period of time. Those are the scenarios that are always heartbreaking to see how quickly it can spread amongst a small family group. I think you can also really use geography to your advantage. I think that you guys have been doing that since the beginning. You've had broad range testing. You've been using kind of travelers in and out and been looking at ways that people interact who are travelers who are higher risk versus community members who are there. I think it's important to remember the virus is the enemy, not each other, but we do have different risks associated with that. We have been since the beginning using geography to our advantage as a state with the statewide mandates with people coming in and the testing coming in. And then communities like yourself have built upon that to be able to also use geography to your advantage so that people can have as much of a normal life as they possibly can without spreading COVID from person to person. I think the other thing is we're in this for the long haul, so finding ways to be resilient. So not always, I think sometimes, we're all done with COVID. Like, I am done with COVID. I could be over it tomorrow. That would be great. But it unfortunately sets the timetable. And so I think we have to find ways to make sure that people can live their lives, but then be able to respond. So if you did get a case, being able to quickly respond to that and to see what that looks like and to be able to move back and to have a low threshold, particularly in a community like yours, to test for any symptoms, because you would just want to identify a case as quickly as possible in your community and then do broad sweeping testing, which you've done in the past. But I guess a question back to you all as a community, what do you feel like have been the biggest challenges in responding to this and how can we help more?
Mr. Mayor?
Yes, go ahead, George.
Yeah, Dr. Zink, I've been seeing on the news lately that there's some promising therapies out there and we're fairly close to a vaccine, I believe. Also, I'd like you to comment on the antibodies test. It seems that would be much more useful than the testing we're using now. That's good for a few minutes and that's it. Can you comment on those 3 things, please?
Sure, absolutely. It's a great question about treatment options and vaccines. We have seen tremendous movement. I think it's important to keep that in mind. Sometimes, again, it feels like this is never ending, but there's so much great work that's happening. We have treatment options like we didn't have before, and constantly we're reevaluating and looking at other treatment options. So a couple things, making sure that your body is healthy, active, taken care of makes a big difference. So people who are otherwise well tend to do better. If you have a chronic vitamin D deficiency, you don't do as well, and many Alaskans do. So making sure that you are getting enough sun or taking a vitamin D supplement can help keep you protected. Making sure that you are then getting tested early on because certain treatment options, including like bed positioning, so like rolling over in bed, what we call pronating position, can be a helpful way to help protect the lungs. So there's even little things that can be done at home. And that's one treatment option that we've clearly seen effective both in the outpatient and inpatient setting. Making sure we're keeping a close eye on people's pulse oximetry, because some people's pulse ox can go low without even feeling like they're sick. And so there's different ways that we've started to watch that even in the outpatient setting. There's antiviral medications that are now available, and we've been very fortunate in the state of Alaska that anytime we've needed to give someone an antiviral medication, this one called remdesivir that's FDA approved, we've been able to. That's very different than most other states. It's a very limited drug still, and so we continue to watch those cases closely. There's treatment options with additional things like convalescent plasma, which is essentially where you take antibodies from one person who's already fought the disease and give it to another person. We're starting to see what's called monoclonal antibodies, so manufactured antibodies that can be given to somebody either when they've contracted the disease or if they've been exposed to the disease, like a healthcare worker. So we're seeing movement on that front as well. There's over 135 different vaccines in trial right now. There has one that has been approved in China. We continue to watch internationally. There's a couple that are in phase 2 trial here in the United States, and we're being told on a federal level to prepare for possible vaccine distribution by the end of fall. So we are kind of going through our plan and process of what that looks like. The US government is making vaccine at what they call at risk, meaning they think the science and data is good enough for the vaccines that are there right now, that they're producing large quantities of it, so that if it really does prove in a phase 3 trial that it's safe and efficacious, that it could be distributed at larger quantities come the end of the year. So we're seeing a lot of progress on that front. We're also seeing different treatment options in the hospital and the pre-hospital setting that are constantly being tested out, both for medications, inhaled medications, oral medications, and we continue to watch that data and science closely. The goal is to do no harm. All medications have some side effects, but we want to make sure that we're finding a good risk benefit for each person, and we see progress on that on a daily front. That's vaccines and treatment. Your question about antibody tests is excellent as well. Unfortunately, the market was flooded with a lot of really bad antibody tests at the very beginning of this that tested for a coronavirus, and four major coronaviruses circulate on a regular basis that cause the common cold, and they would become positive with that. The other thing is all tests are limited, and particularly when there's a low pre-test probability, meaning very unlikely that people had COVID, a higher chance that we'd have false positives with that antibody test. We do use antibody testing in looking at cluster investigations and looking at different outbreaks to better understand what's happening along those lines. But a community like yours that hasn't had a diagnosed case, the chance that you would have a false positive is way greater than having a true positive. And so it is really good in a high concentrated area. It's not good in a low concentrated area. The other thing about the antibodies that we don't fully understand, there's multiple different types of antibodies. There's IgA, IgM, IgG. They last for different periods of time and they mean different things. And we also are seeing a different type of immune response called the T cell response that seems to be very important in this. We don't test that on the antibody test. And those antibodies decrease over time. And we don't understand yet if the antibodies give you long-lasting protection, which antibodies might, and how long that would last. And so we're concerned that we see those antibodies decrease after 8-10 weeks. And so even if you had it, you may not have immunity to it later. We would hope that you would have some immunity to it for at least some period of time. But the normal circulating coronaviruses don't have a long immunity. They last about a year. And then those antibodies, that's why you can get the cold every year. And so we continue to learn a lot. And unfortunately, this disease hasn't been around long enough for us to really have a good sense of what that antibody test would tell us. So right now, we're not using the antibody test at this point in Alaska for the infection widespread, because we don't believe that there's been enough disease for that to be a useful tool. We're using it in these cluster investigations. We've also gone past as well as our previous influenza swabs and hospitalization rate and all these other ways to look at to see if there was any chance that COVID had been circulating in November, December, and we don't see any evidence of it any which way that we checked and looked. And so we really don't think that it was here in Alaska until probably February-ish. And so that's a little bit hard to look at. But even if we had 5-7 times the number of cases that we're testing for, which is kind of the liberal end, it still would not be high enough in the state to make an antibody testing very useful unless it was in a certain cluster. So sorry, long answer to a lot of questions about those, but the science is what gets me really excited.
That's all right, very good, thank you.
Anyone else, questions? Yes, Cassidy, go ahead.
Yeah, thank you, Dr. Zink, for breaking out of your super stressful full schedule and being with Seldovia tonight. I really appreciate it, and I really appreciate your efforts on getting information out to Alaskans about COVID-19 and your expertise and your knowledge. It's very much valued. I'm wondering if one scenario that our emergency management team has been talking about, of a realistic situation that would be here, is that we would, we're anticipating that we would have a positive case as a result of symptoms showing versus an asymptomatic positive. And we come back to the question of, okay, if somebody is symptomatic and they test positive through contact tracing, which is very important at that point, there's so many layers of our lives that overlap here in town. We have, we have one grocery store, we have the post office that people go to every day. We just have a really tiny bubble that we all mingle in. And I'm wondering if that, that possible scenario of a symptomatic positive test, is it going to be too late to have, an outbreak or a potential outbreak? And it's maybe a harder question to answer, but is that a realistic scenario for a community such as our size? And is that a way for our emergency management team to approach, the what if scenarios and try to develop plans for those?
Yeah, no, I think it's a great question. I think it's one of the things I love about thinking about Alaska's unique challenges. So, if you're in New York City, we're going to really just try to think about those close contacts, because there's no way you can test the whole city to see what that looks like. But I think it looks Adovia a little bit more like I think of a long-term care facility, that if you got an outbreak, the moment that someone was symptomatic, you can do contact investigation, but you could even just stand up and say, if anyone is concerned that they may have been exposed or asymptomatic at all, we want you to get tested right now, or consider testing, 50% of the population one day and 50% of the population another day, and encouraging people to get tested. And that way, just like we do in a long-term care facility, you're doing a really big sweep and you're identifying anyone, because maybe it was an asymptomatic person who brought it in, not knowing, not realizing that they had got it from someone else. And then it was only someone else who was symptomatic. So you could identify those cases really quickly. I think it's important to remember that this disease only transmits between person to person. And if we isolate all the people who have the disease and let it go through their course, it doesn't spread anymore. It dies out. And that's how we see, we have these outbreaks, but just like a little smoldering ember, they can be put out. And so you can have an outbreak, and that doesn't mean your whole town's going to get run over. It doesn't mean that you're going to have mass death and chaos and all these other things. You can be aggressive and test and isolate and track and be able to put that outbreak out really quickly. Even bigger places like Fairbanks went over a month with almost no cases. And they had a ton right at the beginning, and it was very spread out. But that was through contact tracing, kind of working together and to being able to kind of put out those little embers really, really quickly. So absolutely, I definitely think you can. I think that having that low threshold for symptomatic testing is important. The other thing that we've seen useful at particularly some of our hospitals and long-term care facilities is just to say, if you're concerned, we've got testing available for you. Someone had an exposure that they don't want to tell you about, or maybe they don't want to admit that they've not been feeling well because they need to keep working, or there's lots of reasons why we kind of push through things on a normal basis. And instead of like checking that box, they just want to make sure that they don't spread it to their mom or to someone else who's more vulnerable, and so would get tested. And so I think having that low barrier for threshold for testing, and also not stigmatizing this disease. I worry about communities like yours that have not had a case yet, that when that first case comes, everyone will say, that one person. This is an incredibly contagious disease, and around it continues to be, and we just need to be vigilant and supportive and realize if it comes in, we do the work that we know how to do to identify the close contacts and put it out and keep moving forward.
Any other questions?
Yeah, Mr. Mayor.
Pardon me?
Yes, I have a question.
Okay, go ahead.
Thank you, Dr. Zink. I have a couple questions here. The first one is I'm trying to get into first of all, I'm one of those people that's long over this whole thing. It's this has been tough. The one thing I'm questioning is why, I mean, and you guys probably haven't figured this out, but why is it that in families and close knit quarters where not everybody is testing, if one member gets it, how come the whole family doesn't necessarily get it? I mean, is this thing maybe harder to transmit in some cases than others, and then I know there's whole families that have all gotten it. I'm just curious of that. I mean, you guys must talk about things like that.
That's great. And I appreciate the pushback, and I'm over it too, honestly. You and I both in so many different ways. The science is interesting, but besides that, so a couple different things. It's hard to know how everyone interacts with their family, right? It's hard to know, is someone or two people sleeping in a bed together, or is everyone in one room together? It's also hard to know things like bathrooms. So there's some evidence that live stool can be, or live virus can be in stool. So if some people might be sharing one bathroom, it looks like there's a little bit more higher risk of sharing it amongst those people. So like my kids share a bathroom, would there be a higher chance that they would have it? The other thing is it looks like little kids probably don't transmit it as much to each other or to adults to the same degree. And so probably age has a component to do with that. It probably also has to depend on how symptomatic they were. So if someone is really not feeling well and is coughing and sneezing a lot, they're producing a lot more droplets. And just depending on who they did. Also, surfaces can make a difference. So say it's, someone who is going in and out of the house a lot, touching lots of surfaces, and someone else really isn't because they're working at home in a more isolated scenario, or they're out on a fishing vessel, so they're not as connected. So those are all things that play into it. In general, about 80% of household contacts will turn positive. So not all, but in general, about 80% of household contacts do turn positive at some point. I will say that that number appears to be decreasing. And I think that's just because we have more understanding about the disease. And so we're able to isolate people really quickly. Like there's one family I'm following right now, and the dad's positive, but he had a high risk exposure. So he was like sleeping in the camper and then only coming in for food and keeping everything separate. And everyone else has still been negative. So I think that there's things that we can do to mitigate it.
Okay, I appreciate that. Yeah, that's been boggling me a little bit on, how this thing's transmitted. My second question is the metrics by which we're managing this whole thing. So right now it's all based on positive cases. So here's my pushback and my concern is the low fatality percentage or mortality percentage, right, in our state. Now, any fatality is not good. I recognize that, but when we're talking 1%, and then and you weigh that against the socioeconomic carnage that we're happening right now, and I think this winter, I think there's going to be a lot more of the mental health stuff that's going to happen, the depression, all the things that go along with people not having money and failing businesses and repossessed houses and cars. And I don't think we've seen that yet because of all the artificial stimulus that we have right now. But when that goes away and reality sets in, I think that's going to be big. So my question is just, do you foresee the state managing this, by a different metric, maybe looking at, okay, so if we continue to have, maybe every day our case count's going up and we get into the thousands and thousands, maybe we hit 10,000 positives, yet we remain, at that 1% of mortality. If the cases go up, do you anticipate like another shutdown? I don't know. I guess I'm trying to balance that, the justification for the carnage. That's what I'm getting at. And you might not be the right person, but I'm sure, I know you guys have some crazy discussions about this, I'm sure.
You're right about that. We do have some crazy discussions. There's a lot of kind of balancing all those things out that are talked about, and that we're always trying to figure out the balance. And you're exactly right. When I came to work for the department is I really love the mission. It's the health and well-being of Alaskans. I'm not the doctor of COVID. I'm not the doctor of, any one of these things. And the things that you mentioned are really important. In general, when people's economic health is better, their physical health and their mental health is better. They are closely connected for all of the reasons that you just mentioned. Suicide, alcohol rates, substance abuse, those are all things that we're doing in the background. We don't talk about them on the press conferences the same way. We have a syphilis report coming out tomorrow for anyone's interest. So we are constantly looking at these things and continuing to try to make sure that we're educating. We're trying to have the most, I guess I would say, kind of strike team, surgical response that we possibly can to have the least impact on people, so that people can, this is long and this is hard, and we need businesses to thrive, and we need communities to feel connected, and we need schools to be, connected, and kids to be educated, and we need grandparents to be connected to their loved ones, and we need people in nursing homes to be able to see and visit people. Those are all really important things that make us incredibly happy. But that doesn't mean we ignore the virus and we don't see it. And this is why we've really stood away from saying number, we're going to do X for, if we get to 200 cases, we'll do this. And the reason is because partially what you mentioned, and then also because the way that we've been able to, what we know about the disease as well as the numbers changes, and we're learning new things every day. So we have more cases now than we've ever had, 100%. At least we're able to see them. We have more cases positive. And each one of those cases is important to remember is an individual person. So if people test multiple times positive, we only count it as one person. So we have more people now that have tested positive than we have, but we haven't shut things back down. Partially because we're testing a lot more. I kind of think of it like an iceberg. At the beginning, we saw this little tiny tip of the iceberg and we couldn't test and we didn't know what this was going to look like. And we were looking what was happening around the rest of the world. And we needed some time to build up our testing supplies and our hospital capacity so that we didn't get completely overwhelmed like we saw in New York and other places. And we did that for the shortest time we thought possible. And as soon as we started those numbers going up and we started to produce testing and other supplies, we started to open things up within the state. That being said, it still had disastrous economic impacts. And I would say even states that didn't shut down and countries that didn't completely shut down have also been economically devastated by this virus. There isn't a place in this world that isn't right now. And that's because we're all so interconnected.
Thank you, Dr. Zink, for your time.
Yep, I'm going over.
Yeah, I had a question.
Yeah, go ahead. Heidi, would you come in here, please?
Is Dr. Zink still on there?
I
All
am.
right. Yeah, go
We
ahead.
just had a little glitch.
Okay.
There we go.
Sorry, our Zoom meeting just went out. And I'm back on. If you guys can hear me, I think Heidi's gonna.
Yeah.
Mayor Lent real quick. I'm sure he won't mind if I let Curly ask Dr. Zink the question. Curly?
Yes, Dr. Zink, I'm wondering, all this testing and out of 1,000 people that test positive, how many of them are hospitalized, or are they tested positive and they just stay at home and get over it? And what is the incubation period of this on average? I'm sure other people are affected longer than others. Is this a couple of day flu-like thing for most people? Obviously, if you have some underlying issues, it's definitely going to be a lot worse. But just wondering if there's some kind of a stat on if a normal healthy person gets it, what's the period of being contagious and whatnot?
It's a great question. So nationally, the data is running about 15% of people who get the disease that are diagnosed are hospitalized. That is dropping as we're testing more people and I think identifying more asymptomatic people, and it's lower in the state of Alaska. We also have about 1/10 the mortality of other states in general, and I think that's because we've kept it out of our most vulnerable populations, particularly the long-term care centers and the prisons and some of our rural communities, and why we continue to really put a lot of time and effort on those areas to make sure it stays out of there. Most people do fine. Most people have very mild symptoms or are asymptomatic, but people of all ages can get sick. People of all ages can be hospitalized. However, the older someone is and the more comorbidities they have, the higher likelihood that they will need hospitalization, that they'll need oxygen, or they could potentially pass away from it. A study out of Kaiser showed that about 1/3 of Alaskans do have one of the underlying risk factors, either age or one of the underlying medical risk factors. There was a report that came out from the CDC today. Based on that, it's probably more like 45 to 50% of Alaskans. So unfortunately, it's not like 2 to 3%. We're looking at, nearly half of us have at least one or more of the risk factors associated with not having as good of an outcome from COVID. That doesn't mean if you have one of those, you're going to need hospitalization or you're going to die. We see older people who do very well. We see people with multiple comorbidities who do very well as well. It's a gradation. It's from this was nothing to I can't believe how awful this was and I lost my loved one. And you see all of the spectrum of that in a similar sort of way that we see with the flu. I mean, some people just feel really miserable with the flu, and we see young kids and older people who die every year from the flu. What's very different about this is what you mentioned, the incubation period is longer. So the incubation period, most people show symptoms between days 5 and 7, but can be up to 14 days, which is a really long time for a disease. This appears more contagious prior to showing symptoms, which is different than the flu. And we're also learning more about this disease, including its effect on the coagulation or the body's ability to clot. So it does appear to cause some strokes in younger people, as well as kidney problems and gut problems. It appears to make the blood clot. So while we get it from a respiratory disease and it can have some respiratory symptoms, it's not as just focused in the lungs like the flu. So there are definitely some major differences between this and flu. And then there's differences in vaccines and treatment and other ways that we mitigate flu that we don't have for COVID right now.
All right, thank you. And one follow-up, I don't hear of many natural causes and just natural deaths anymore. Everything seems to be COVID related. Do you think them numbers are getting kind of mingled in amongst each other, or I just know that we lose many people every year from natural causes, and I don't hear nothing about that anymore.
Yeah, so it's a great question. I think this is where medicine, science, and like public policy all kind of mix together. So for me as a physician, I never write on someone's death certificate natural causes. It may be that they had a urinary tract infection that caused them to have an overwhelming infection and then their heart and lung stopped. I might list all of those on there. And so a 20-year-old might have a urinary tract infection and be fine, and it might kill an 80-year-old. And so different people respond differently to different diseases, and we see the same thing with COVID. So we really want to be super transparent with our data. So every time we list COVID on a death, it's because the physician said that they thought it was related to the cause of their death. So and oftentimes we're calling them back and we're like, is that really what you want to put? Help us understand exactly what this is. And it's the same with flu. It's the same way that we do it for everything else. So if you had COVID and you got run over by a car, it wouldn't be listed on there if the doc didn't think it was. But if you had multiple underlying medical problems and then you developed a fever and were more short of breath and then became confused and then your heart stopped and your kidney stopped, the doctor may list COVID, but there may be many other reasons why COVID was more serious for you. Every person who has died in the state of Alaska has had underlying health conditions. It doesn't mean that that's always the way it's going to be, but that's definitely the case so far. The other thing is we have to follow these national guidelines that make us report on any case of an Alaskan resident. We have had 4 people who are Alaskan residents who did not get COVID in the state of Alaska and died outside of the state of Alaska. But by national requirements, we have to list those. So again, we try to be totally truthful and honest about them, but that's just the reporting mechanism that there is. We have a website that's going up that really explains the death certificate process. There's actually 4 listings of who and where and when and why. And again, we do it exactly the same that we do for heart attack, stroke, flu, all of the other disease processes. We use the same process and we use the physician, what they put on the death certificate to list it.
Thank you.
Thank you.
Mr. Mayor, if I may, one point, a comment and a question.
Very well.
Yes, Dr. Zink, thank you again for your time. My comment is because you were asking about how does Seldovia, what's happening in Seldovia. And our demographics, there is that 65, 60 years old. It's a high percentage here. And I guess the conversations that I have with folks, and because I live right on the boardwalk, I see the tourist traffic walking by, and there is very few masks. And I also see a lot of people coming from outside of Alaska or in Alaska coming down to visit, and they're within their family bubble, but then they're going to go visit another family. So you've got this whole one little social bubble joining another social bubble that aren't necessarily seeing each other in Anchorage or wherever it might be. So that's disturbing for a lot of people here in the lack of masks. And thank goodness, maybe we will fare through this without any cases. But that is concerning for a lot of folks here because, and so here's my question. Because I asked people just out of curiosity, they flew in from California. I said, oh, so what's the deal? You came to visit. And they said, yeah, I had to test, show my negative test. And then I have, and correct me if I'm wrong, I have 7 days that I can be in Alaska and then I have to go back out. But if I'm here longer than 7 days to the 14 days, I have to have a test. Where's the follow-up with that test from the state? Is that correct? And maybe correct me where I was off.
No, so you're exactly right. Well, I think you're pretty right. Exactly what they said. So we asked for people to get tested prior to coming in, and about half of people are getting tested prior to coming in now, which is great. That is just a single point in time. They could have been exposed in transit. And we also know that while there are very few false positives for this test, there are quite a few false negatives. So we may not have picked up the virus at that moment. That's why we're asking people to minimize their interaction for 7 to 14 days after they come in. And the reason is because we want to make sure they're not having as much interactions. You'll see that Anchorage built a lot of their mandates around that 7 to 14 day window, saying, don't come into our restaurant or our bars until after that 7 to 14 day window and you've had the repeat test. The reason is this range for 7 to 14 days is at day 7, if you tested that day, you're going to get about 80% of people who are positive. And by day 14, you're going to be more like 90-95% of people who are positive. And so really you see that peak increase by day 7. And so it was a way to try to pick up additional people and minimize interaction until they can have that second test, since we had 2 separate tests separated in time to minimize their interaction. So things that you can do, again, like not having people come into the store or into bars or restaurants until that 7 to 14 day test has been complete, will help to minimize your risk of exposure. Masks do help. They have become politicized. They're a big deal, but they really do help. We asked a bunch of communities what they felt was a limitation. Many people said free masks. So we asked HHS if they would be willing to send us more free FEMA face masks. And if you all want to ask for them, we just put in a request for 440,000 masks, and they're sending them up this way. And so you could request as many as you wanted, and you can, if you print them at 100,000 a piece, they're 50 cents a piece to print. We were just looking into this. You could make a cool little Seldovia thing and hand it to every visitor who came in. So if there's other things that we can do to help minimize that barrier, get people to wear masks, we're all about it. Because particularly with an older population, really would hate to see an outbreak going on and want to keep it at bay in as many ways as possible. The other things to be thinking about is the way that traffic and people move. And I don't know your town and the way that people go down the boardwalk or other areas, but again, looking at the long-term care facility guidelines and thinking about applying that to your community, so visit in kind of isolated areas, or if they're going to have family visit, that they don't interact with the rest of the community for the next 7 to 14 days or until they get a test. And so that's another tool you can do. Okay, if your family's coming to visit, that's fine, but don't come and interact until after that window to make sure that you didn't accidentally pick it up.
Thank you.
Any other questions for Dr.
Yeah,
Zink?
Mr. Mayor, can I get one more?
Oh, go ahead.
Yeah, Dr. Zink, just a numbers question, if you could correct me if I'm wrong in my stats here. I think about 2.8 million people die in the United States every year of all causes. Is that about right?
That sounds about right, but I haven't looked at that one recently.
Okay. I got the number offline fairly recently. The other thing, we've seen about 130,000 deaths to COVID in the
US.
United States. How does that number compare to the other major causes of death?
Yes, that's a great question. And it depends on where you look. So if you look in places like New York, it just plummeted other cases of death. So it was by far the #1 cause of death, overtook heart attacks, strokes, all other causes of death in a very short period of time. It has not yet fully in the United States yet, and we continue to watch it. And it definitely has not in Alaska. So in Alaska, other causes of death are by far the leading predominating. The problem is this pandemic's not over and we're not sure where it's going to go. And that's why we want to be proactive. I'd rather learn about it without learning about it from the desk. There's a visualization tool on the CDC website where it kind of shows kind of the normal variation with flu and where you see and what the epidemic threshold is. And when we've had other flu strains that have kind of crossed that, and then and the mortality associated with it. And then you can just see this gigantic spike that happened with COVID, particularly when it hit in New York. And now it is almost down to basically epidemic levels. It's come way down since that time.
There were no deaths in New York the last 2 days, I believe.
Exactly. So it's come way, way down. Unfortunately, in the last couple of days in Texas and Arizona, we're starting to now see nationally deaths climb. And so hopefully we're not going to see that big spike up, but what we're hearing out of Texas, Arizona, and Florida is not promising right now. And so I worry that we are on another big swing of hospitalizations and deaths coming up. And again, I think that's where we as Alaskans watch this. We learn from it. We protect those who are vulnerable. We get tested the moment we're symptomatic, and we wear masks and hopefully not have to, as Jeremiah brought up earlier, shut things down, keep moving, but minimize those who are most vulnerable in our community and not have to repeat what we're seeing in some other states right now.
Thank you very much.
Any other questions? I'll say again, if there's no more questions, thank you, Dr. Zink, for your time and information. We appreciate it.
Thank you
Mr.
very
Mayor,
much.
Cassidy, you say anything?
Is there anybody from the public that would like to comment? Heidi, if you can follow up.
Yes, thank you, Mr. Mayor. Actually, I do, one hand just raised with that invitation, so I will, is Amy on the line? Amy, you're on the line now?
Okay, can you hear me?
We can hear you.
Okay. Thank you, Dr. Zink, for coming and being part of our community this evening. I just had a couple of quick questions. I heard a few people mention that we don't have any reported cases and so far in our community, which is awesome. My question is in relation to information about communities of our size, and how do we know if and or when there will be a positive case or potentially positive case, since there's the HIPAA regulation of not disseminating information for communities under 1,000. So that's one question, kind of a two-part question. And is there a potential for wastewater testing to help provide information to our community if we aren't able to have those case-by-case information, that case-by-case information released to us?
Great questions, and that comes up resulting in communities less than 1,000, and how would you know or not know? So you're exactly right. We report those out to as a community as a whole. What we do is we encourage individuals who have tested positive to share that information, because if it's your information to share, you can share it. So that's what we've seen in many small communities, that people have been willing to share that. Oftentimes their healthcare provider will know as well. And so they may choose to, in combination with that person, disclose to the community, I'm not going to say who, but there is a person in this community who has tested positive. Therefore, we are going to do widespread testing and we're going to have a response. So a healthcare community could choose to respond basically with a response without naming that individual. Part of it, like I mentioned earlier, is just the concern for stigma. And not only are we required to follow HIPAA guidelines, but we actually have a bunch of additional state regulations that are even more strict that prevent us from telling. The other thing is people can sign up what's called a release of information, and they can sign it for a healthcare provider, they can sign it for a tribal entity. People sometimes sign it for the states. We're seeing many smaller communities do this, or schools are now doing this, where basically anyone who's coming in would sign a release of information. So if a positive was there, then the principal would be able to know, or then the EOC would be able to know. Something else a community could choose to do if they chose to, but it really is up to individual people to decide if they want to share that information. But a community like yourself, I just oftentimes it seems to go much better when that person shares that information themselves, so that rumors don't get spreading, people can help support that person. We saw that in Ketchikan at the very beginning. One of the first cases just said on Facebook, like, hey, it's me. and people really supported them and rallied around him, and they got the cases down really, really quickly because people were transparent about it. The question about the wastewater is great. We've been working closely with colleagues on that topic. We aren't quite there yet. There's some kind of FDA components to it, but they are looking at wastewater. For your community, I'd have to go back and circle back with them to see if the concentration would be high enough to be able to have that useful tool. But I know even like universities are looking at it for looking at their wastewater. The one problem with that is it probably it comes up a few days before it starts to show in kind of hospitalizations and increased cases being picked up in other forums. And so how useful that tool is still remains to be seen. And that's in big cities, and we're still trying to figure out how we use it successfully in smaller communities.
Anyone else from the public?
Yes, Mr. Mayor, we have Miss Cindy Mom on the line.
Oh, go ahead, Cynthia, Mom.
Okay, can you hear me?
We can hear
Yep.
you, Cindy.
Great. I don't have any questions. I just really want to thank you, Dr. Ann Zink. Alaska is really fortunate to have you, and your energy and your leadership have really been an inspiration. So I just wanted to send that back to you because I feel really grateful that you're here and that you are taking the time to talk to us in our little town. So thank you very much.
Well, thank you for that. After a very long day, it's very nice to hear. And honestly, it's really, this is the stuff that I enjoy the most of the job, is getting to hear directly from Alaskans, what's working, what's not working, and how we can partner together. It's much more fun than some of the other.
Yeah. Well, thank you.
Anyone else from the public? If not, Cassidy, you have comments?
Yeah, thank you, Mr. Mayor. Again, Dr. Zink, we can't thank you enough for taking time and helping us out with some of our questions and hopefully bringing us a little bit closer together during this really hard time. So we appreciate your efforts that you do for our community and for the state, and take care and let us know if we can do anything for you. So maybe someday you can come visit. So we really appreciate you though.
Well, thank you. It's been on my bucket list for some time, but I haven't made it yet. And so I'll just have to virtually participate now. But thank you all. Thanks for the invite. I'm always happy to come back. And so is the rest of our team. So Dr. Joe McLaughlin, other people on the team, if there's other science questions, other ways that we can support. Thank you also for your creative work. I know that we've been sharing your work with many other communities because you've been an inspiration since the beginning. So I appreciate it. Happy to come back.
Okay,
Thank
thank you.
Dr.
You.
Thank you, Dr. Zink. Thank you.
Right. Okay, back to the issue. We had a discussion on events and gatherings in municipal property during COVID-19 epidemic. Any more discussion from the council? If not, we'll move to public comments soon. And anybody from the public care to comment on this issue? Hearing none, we'll close public comment. This was for discussion only. Do you need any kind of action on this, Cassidy?
Nope, if it's okay with the council, I think what the staff and I will do is we'll utilize this policy as well as create a general permitting process for events, and we'll bring those back to the 27th meeting in resolution form.
Thank you. Moving on, discussion, please. Chief of Police position and job description. Cassidy?
Thank you, Mr. Mayor. So as you all know, Chief Cushman has put in his notice, and his, let's see, just for your reference, the police chief position opening that's advertised right now is in your regular packet, and then in the laydown packet, starting on, hold on, I'm deep in, nope, that's not it either. On laydown. Where'd it go? There it is. I have way too many things open. Okay. There we go. Sorry about that. In your laydown, beginning on page 12 with the resignation letter, Chief Cushman is and his family have chosen to get out of law enforcement completely, and they're going to pursue a new pathway, and we wish them all the luck in the world, and we are very sad to see their end in Soldovia, as I think we all felt that he was a very good fit for our community as well as his family. So he will be missed as well as Jennifer and the kids. So I do want to put that on record that he will be very much missed and a huge gap to fill. And so we're here to talk about that gap. I put together a proposal that just gives the departmental history, kind of from Chief Anderson, from his 32 years here, and then forward from 2011 to now. And we've had an issue with retention, and a few years ago, the council and myself have worked towards creating a viable position, what we hope to be a viable position that was really attractive to seasoned police officers that would want to come and set down roots here, but also hope for a certain amount of retention, so we didn't have a revolving door, so to speak. And so we invested in the department. We went from about $75,000 to $60,000 annually, up to $84,000 annually for the department. And as we all know, money's not the final end all to make quality of life and quality of living optimal. And I think with the current national culture and the reputation of police departments and just the energy that is surrounding police departments nationwide, I think it makes it difficult for people to want to go into police and law enforcement, but also has people like Chief Cushman have to make those huge life decisions to choose a different path. And that's completely understandable considering the amount of risk that he has put forth for the city of Seldovia, but in his entire career, and that risk seems to be growing. And so before we get into, the fiscal details or restructure, I do want to bring your attention to page 17 of the laydown, where Chief Cushman had written out a piece of his perspective that I think is very valuable in this discussion. And I hope that you all have a chance to read it or have already read it. Chief Cushman is also on the line for feedback and questions if you guys have them. But I do think that his perspective is very important in this discussion, as well as more discussions that I think that we're going to have about the department, based on the reasonings why he's choosing to move on, but also the reasons why he felt that he couldn't stay on here. So I will leave it to the council to open up questions, comments, concerns, anything for either Chief Cushman or myself.
Mr. Mayor?
Yes, go ahead, George.
Cassidy, this social situation might work to our advantage. You might be able to send a letter to a city like Minneapolis and say, hey, we're looking for a good police officer that would have the community support behind him and maybe have lots of applicants.
I agree, George.
Just a thought.
An opportunity.
Yeah. As I understand it, there's a lot of folks retiring and leaving the profession, just as you say, in big cities, because they're put out there on their own.
Any other comments?
I had a comment, Mr. Mayor. Yeah, I was reading through Paul's letter here, and yeah, I mean, there's a wide variety. And first of all, I mean, I agree. Paul's been a great fit for the community, and we've been through a number of people, and I think Paul and his family, they fit the community well. That's the type of policing in my mind that I was looking for. Someone that wasn't going to be a complete hard ass all the time, every day. Someone that, could talk to somebody, let them know they're screwing up, and say, hey, let's tune it up, give a person a chance, and, after the second or third time, then it's either a ticket or jail. So I'm thankful for that's where we ended up. And I hope that, as we move forward here, that's the type of person that, we look for. The money thing, I know that's going to be challenging. It'll continue to be challenging given the environment and law enforcement. I do agree with what George is saying, though. He makes a good point. I mean, why do a lot of us live in Seldovia? It's lifestyle. It's total lifestyle. I like it there. I think most people that live there really like Seldovia because of its, the quietness, the people, the friendly atmosphere, all of that. So that's what we're going to have our recruiting efforts. It's going to be interesting to see. I think we do have a much better package than we've had in the past, obviously. I don't know if tonight's obviously probably not the time to discuss salary. I think we need to see what happens if we get, applicants, first of all, see what comes in. If we don't get anybody, that won't be good. And that'll be kind of an indicator, a leading indicator that we might have some problems. But I guess my opinion is, it's we post it, see what happens, and then it'll be like anything else. If a person wants to do it and, money's the main issue, then it'll be a negotiation thing, whether or not we can meet and find some common ground. So, so I mean, that's kind of what I'm thinking right now, but I'd be interested to hear what anybody else has to say.
Hello. Yes, John, I have one of the things that stood out to me, and I've brought this up years ago, was only having one policeman here. There is no personal life or personal time. No matter what you do, if you go out with your family, you're still, if anything happens, you're at work. There is no 8-hour day. It's 24/7, even on your days off. If you're in town and something happens, you're working. That's a big thing, not having time for personal life, where if something comes up, somebody else can handle it. That's one of the big issues that I see. And I brought this up before, and I know in the first argument to come out was we don't have the money for 2 policemen, but if you only have one person, it's 24/7, 365 days a year, and the only time away from the job is vacation, which Andy used to take 4th of July off and leave town. Regardless, it didn't matter what was happening, he left. And he didn't come back till his vacation was over. So that's one of the things we need to discuss about that is you can only do that type of work 24 hours a day, 7 days a week for so long before it wears on your brain. You need personal time. That's all I have.
Okay. Anybody else comments?
Mr. Mayor, Vivian.
Go ahead, Vivian.
Yeah, thank you. Paul, we're going to miss you a lot. I appreciate your comments that you wrote down, Paul, and if I could, one was I hope that we did as a city council support the police department by cleaning up the city ordinances. And if we haven't done that all the way around, I hope we can continue with that. And I guess the question I have for Paul, it is a one-man show. And so Paul, is there enough work to be done by 2 people? Or how do you see that working? 2 part-times? And could you put any input on that, Paul?
So, yeah, that's a great question. Like 2 people on at the same time, I necessarily the way I describe it to people often that ask, I would say, jokingly, kind of tongue in cheek, right? That 95% of the time I feel like I can place with a cardboard cutout strategically located around town. And then there's 3 3 or 4% of time that I feel like I'm actually helping people and I actually was able to be used in a way that only a police officer could have been used. And then there's, 1 or 2% of the time that I feel like I needed 3 or 4 of myself, because, I was obviously dealing with something that definitely needed a more of a team. So I don't think it's necessarily the benefit of having 2 people on at the same time as more. And then I think like in Cassidy's proposal of having either a rotating 2 week on, 2 week off, or some sort of rotating shift like that, where you did have two officers that had a chance to not be here, or to at least to have their time where they were completely off duty. Or certainly I could see what you're saying. If you did have 2 part-time people, obviously that the struggle with that obviously would be, just the financial part, obviously, unless it was a local that already lived here and already had things and could then therefore do this part-time on the side. But that way you had somebody that was on and somebody that was off. I think a lot of small communities that are like this, like I said, they are doing more of you're seeing more and more, even the troopers are doing this to fill some of their more remote bush positions. They are making a rotating schedule of 2 weeks on, 2 weeks off, 3 or 4 weeks on, just to fill those on. So that way the people can leave that community and not be, Officer Cushman. They can just be Paul and be, have some normalcy in their life.
Thank you, Paul.
Any other comments? No more comments from the council? Do you have any comments from the public on this issue? Hearing none, we'll close public comments. This discussion only. You have any comments, Cassidy, on this?
No, so the position's posted as it's in the regular packet as that, and will, unless there's a huge push to restructure the department at this time, we'll just go status quo and see if we can attract any possible candidates. Question?
Yeah.
Okay.
Well, I have a comment. Dean,
Go ahead, Bobby.
I know we've discussed this for a while after Andy retired, and we had the first couple policemen we hired. It's a struggle. Yeah, and all I want to say is, I don't know what we're going to do about it. And Paul, we're going to miss you. And thank you for everything that you've done. I know that wasn't a very good comment, but that's all I can say.
Thank you very
Any other
much.
comments? If not, Paul, I want to thank you. It's been great having you here, you and your family. So thank you a lot.
Thank you all very much. I very much appreciate the opportunity.
Okay, thanks. Okay, moving on. Administration reports none. Treasury reports none. City manager report, see lay down. Cassidy?
Yep, thank you, Mr. Mayor. Page 20 of your laydown. So, same old, COVID-19 management, mitigation, coordination. We're continuing trying to make sure that we're getting all of the right, accurate information and seeing how that applies to Seldovia, and seeing if we need to make any shifts or adjustments in terms of our planning efforts. And we're just kind of staying on top of that. the Coronavirus Relief Fund program. I do want to thank you all for passing that tonight. I think this is going to be a very positive aspect of Seldovia in this, what is considered just a hard, challenging time for everybody. So we're hopefully going to see the success of that rollout. The CARES Act expense tracking, Jan and I are working on making sure that we're on track with that. Again, those funds need to be expended by December 30th of this year. And while we are tracking it, we also want to make sure that whatever we are expensing to that CARES Act money is a valid and allowable expense according to the Treasury management. So we're making sure that we're following all of the rules and guidelines. I'm working with her on all of the quarterly reporting and getting her kind of her footing for that. She's a quick learner and makes teaching these things very easy. She picks up very quickly, and I can't express how my level of gratitude that she's on board with us and working in our office. We've just finished FY20 and getting into FY21, so we have some year-end things, and we also have some audit prep going on. The police chief position, that's obviously something that's been on our plate for the last few weeks. I've included here the Kenai Peninsula School District Smart Start Plan. This is, they're actually having a school board meeting that was tonight at 6. They've been working on their Smart Start Plan to start hopefully getting kids started back to school. The Kenai Peninsula School District has pushed back the start date by 4 days, and that was going to be either approved or disapproved by the school board this evening. So the start date, I think proposed start date is August 24th. And we are staying tuned to what that's going to look like for the school year and what we can expect as a community. But this dovetails into my next subject is kind of we've been meeting as a staff and discussing what's going to happen to some of our employees with school-age children that are in the school, that are enrolled in school. And if they are not able to be in school full-time, what will our options for our employees be? And I am one of those employees, as well as Heidi. And we have a lot of love for our jobs and our positions and our level of responsibility, but we also have that same amount or even more love and devotion to our kids and making sure that they are taken care of first and foremost. So I kind of wanted to get your guys' temperature on flexible work options for employees with kids that may or may not have kids at home, learning from home, and what your expectations are of employees that are facing that dilemma. It's hard. It's last spring, I'll be very honest with you, it was very hard to juggle 3 kids at home and come in here on crazy hours and just try to do that rigmarole. And my middle child suffered. He had a really hard time with online learning. So I want to make sure that Jordan and I are right there with him to succeed and get those educational building blocks that he needs as a 8-year-old. And so we're kind of in this really precarious balancing act of and staying tuned into what's going on at the school district. But I do want to have this discussion with you as a council of what's your feelings on all of that? I mean, we want to do the best possible work for you and the city of Seldovia and our community, but also do the best possible work for our families and our kids. So I'd like to get any comments from you right now, or if you want to chew on it, that's great. Jeremiah, anyone?
I'll chime in.
Okay.
Go ahead, Jeremy.
Yeah, for sure. Yeah, no, I've been thinking about this because I've got a grandson that's 7 and I've got a daughter that's a single parent. and he attends the Anchorage School District, and same thing, thinking to myself, okay, she works full-time every day, and now it's a mess up here just trying to get enough spaces to get before school. I mean, she has to drop them off before school and after school so she can make it to work on time and get, and come get him after school. Camp spots are limited. It's just a big mess. If your school district is offering, different times and off times that other businesses can't facilitate to watch kids, it's a problem for working parents for sure. So I think this whole thing's just been, it is what it is, and I think we're going to have to live with it for a while. I know the whole thing with people working remotely is it's changing. It's getting easier. Obviously, there's still a massive need for face-to-face. People have to conduct business. I think, Cassidy, what you'll have to do is just figure out, whether if it's a rotating schedule, if it's very limited hours, we're not going to have a choice. I don't see things, especially until the school gets back on normal hours, set days a week. I don't see things getting any better here for a little while. So I think you're going to have a juggling act to do. And short, I'm going to be okay with, obviously some sort of reform or some hours, limited hours or changes or some workarounds to facilitate you and Heidi and anybody else that's got kids that don't, that can't come up with childcare on a normal day-to-day basis. So I don't think we have any other options.
Thank you. Anybody else?
Yes.
Yeah, this is John.
No, go ahead, John.
Yeah, I agree with Jeremiah, and I'm a family first type of person. I think we can come up with being able to flexible hours and being able to work at home so your kids can be educated. That's important to me. I think the city will make it through this one way or the other. That's just one stumbling block. We just have to figure out how to make it work. Thank you.
I have a
Roll call,
comment.
please. Go ahead, Bobby.
Yeah, I think during these times, anything's on the table. So I think whatever kind of thing the girls have to work out, I support it and I'm okay with it. There's, we have to all adjust these days. So whatever you guys want to do is fine with me.
Mr. Mayor?
Yes, go ahead, Vivian.
Yeah, Cassie, we discussed this earlier, and I'm in full support of having to do what we need to do so you can educate your children and be home with them and then function as a city manager. So I would encourage you and Heidi, and if there's anybody else on staff that has the same issue, to start really kind of thinking about, if you haven't already, what sort of flex schedule you can put together. And then when the time comes to it, it can be presented. But you have my full support with where things are. Hopefully the school will open. That's what our hope.
Yeah,
But-
that's what we're hoping too. But and I thank you guys for listening and understanding. And one thing that Heidi reminds me is that hopefully this is not forever. This is just a blip in our radar right now, and it may be 6 more months, 7 more months, or hopefully when a vaccine can come online, we'll be in a different reality. So I appreciate you guys being open to that, and Heidi and I think can definitely pencil out something that would be workable and functional for both our home life and our job life, our work life. So thank you guys for that. Moving on, I'll be quick, Mr. Mayor. I know what you're thinking. I can feel it.
Okay.
I got one thing before you get off there on another subject, Cassidy.
Mhm.
You think something like an intern might help you through this period? a teenager, say, that could work for very little money as an intern, follow you around and try to take care of some of your loose ends. That be of any use to you, do you think?
Yeah, Heidi and I have been kind of tossing around the idea of what different models that we could incorporate, and an additional staffer has come up in the conversation, and getting that person onboarded and fit in, possibility that would take some of that load off of us, and it's something that we will be exploring.
Okay, well, I think it's pretty obvious you'll have all the support you need from us. So
Thank you. Let's see, we've got our audit coming up in mid-August, so we'll be getting prepped for that. Our census is right at 30%, so we just need a little bit more enthusiasm from those people that want to complete their census for our community. Lollipop Park equipment installation, the footings have been poured and dried. We're waiting for a break in the weather. We are hoping that we could start it right after the 4th of July. We have to pour some concrete pads for the installation, and those are going to take a good amount of time and energy, and we're going to have to take 2 feet off of 2 sides of the fencing. And so logistically, we're putting those pieces together, but we do need Mother Nature a little bit to help out with the concrete pour. So those plans are in place and still underway. Tyler was able to sweep the streets. He had some trouble with the equipment that was sent over. He just can't catch a break, but he did his very best. I know it was dusty, but it was for the greater good of getting our streets clean, and they look super great. So if you see him on the clean streets, tell him thank you. The city department projects, I've got the carpet installations going in the multi-purpose council chambers right now. They're going into the hallway and into the library. Hopefully, I think they finished council chambers today, and they'll be moving in the hallway towards the library. So that should be getting wrapped up, and we should be able to, cross our fingers, have our next meeting as a hybrid model on the 27th. We're also waiting for our all of the pieces of technology that Heidi needs to hopefully have a successful Zoom platform meeting style. So we're working on that. And other things that we're working on are just those in-house items that we've been trying to get wrapped up as the summer's ticking away. I've also included, I wanted you guys to notice, I put in the sales tax summaries. They're good through June of this year, so you can do comparisons. We're about 8% lower than we were last June. So not the double digits, but still 8% lower than we were last year. So that's the least that we could expect, I think, considering our staff. But I also wanted to, our water consumption's looking great. We've got May 1st through July 13th on here for water consumption data for you guys to take a look at. One thing I had Layla do for me is give me kind of the rough estimate of harbor visitors in a span of the 4 days, July 1st through the 5th, to get an idea of where we were in 2019 versus 2020. We were down the total count in the harbor. 2019, we had about 842 visitors, and that composed of both private vessel owners as well as the tour boat passengers. And this year we're right around 650. Boat transients for that 4-day period, we are at 66 this year versus 108. So that those transactions were almost cut in half. And then our 4th of July day use, which we have a lot of that daily rate coming into Seldovia for the 4th of July. 2019, we had 67, and this year we only had 20. However, another interesting stat is that I had to run some sales date comparisons for the 2 years, and our harbor office sales, we had a 2% increase in mortgage rates last year. So from 5/1 to 7/13, well, I put 2020, 5/1 to 7/13, and 2019, we had about 21,000 in transactions for harbor office. This year, for the same amount of time, and we've cut the hours back almost in half, we're at 26,000. So we're doing more business, granted the 2% increase in harbor rates, but we've cut back our expenditures for that department severely this summer. So I just wanted to bring that into light, that the visitors are light. However, we're still busy. Layla said that this Saturday she had 27 transients come in and out of that harbor, which is completely unexpected for a nice day in July. Usually it's hovering at the 15 mark on a really good day. So we are seeing, you know, people coming to Seldovia to visit and using our harbor facilities, and even with the cut hours and the decreased expenditures and workforce that we have in that department, we're still staying afloat, no pun intended. So I thought those were interesting stats for to end the council meeting with.
Mr. Mayor, if I may, or Cassidy,
Go ahead.
you're saying that 26,000 and versus the 21,000 is because there's less overhead that number is up $5,000 or so, or that's just income,
No,
revenue?
the expense isn't included in this. This is just total sales. So
Wow.
21,000 last year. I'm just gonna jump right into my calculator. Let's just do quick math here, times 0.02. 2% of that 21,000 is just around $450. And we increased the rates. However, it didn't seem to have an impact on the number of sales and transients and people that are utilizing our harbors and paying for services for us. So we're doing more sales than we were last year with less staff, which is a pretty good business model.
Yeah.
Yeah. So I hope that we can keep that momentum up and keep doing what we're doing, because I do feel that going on, I don't want to jinx this, on July 13th, where we don't have any reported documented cases, and we're hanging in there. So I want us to keep hanging in there and doing what we're doing, because we might be doing something right.
Okay. Any other comments?
I just had one question real quick.
Go ahead, Jeremiah.
Cassie, and I don't want to get into a long discussion about this, but have you guys thought, I mean, just observations that I make, I'm usually only home on weekends here lately, but I spend a lot of time at the hotel just watching the boat traffic go in and out of there all day long. And on a year like this, when there's no Rainbow or Discovery, is it possible to do something with that temporary transient space to open it up for smaller boats? I mean, it's time and again, obviously we have a super small space, you know, around the ferry where everybody goes, and then you'll get people come all the way down to the fairway, turn around, have to go all the way back around. And I'm just wondering, I mean, on a year like this would be a good time to, you know, open that space up, if you will. So
yeah, let me talk to Layla. I think that it's completely possible. And let me talk to Layla and see what we think that we could get to advertise that and just have her start utilizing that space a little bit more. Sure.
Just a thought. So
yeah.
Thank you. Any other comments, questions for this?
I have a comment.
Okay.
Is it really true we haven't had any broken water lines since May?
We know of one small leak we're monitoring right now, but it's not a full break. So
Okay.
it's like a spring.
Yay. Okay, good job.
But no, our guys are doing really, really good on that. Kevin Shoneman was here last week or the week before, and he's coming again in August. So he's making a huge effort into staying on top of monitoring our system and seeing what we can do to make it more efficient and working as optimal as we can with considering the age of our infrastructure.
Yeah, well, I noticed it's really been helping, and then the guys get on it right away, fixing it. I think that's great.
Yeah,
So
they've done a great
good-
job.
Good job with that.
Any other comments? If not, we'll move on. Chief of Police report, none. Harbor Master report, none. Public Works report, none. Information items not requiring action. Executive session on council mayor comments concerning not on the agenda. Morrison,
Yeah, just great meeting. Thanks.
okay. Rojas,
Oops. Yeah, two things actually. I mean, it's so great to see the water consumption down to the rates that we are at. That is so impressive and just shows that we have turned things around. That's great news. And also I'd like to add for something I might bring up later after I do a little bit more investigation, to see if maybe the Seldovia Advisory Committee, which works with forgive me, I was ignorant of this, works with the Alaska Fish and Game, who makes some changes in their input is asked from the Alaska Department of Fish and Game. If maybe they could be one of our advisories, committees that come to the city council and gives an update. I'm just, and I'm gonna check into that and see if that's something that can happen, and if the city council would be interested in putting them on our committee list. Otherwise, great meeting tonight and excellent work is always coming out of the city office. Thank you all.
Nathan,
I think a lot of kudos go to Cassidy and her crew there for no reported cases. So as you said before, something you're doing right. Got to be there. Appreciate it.
Swett. Swett,
Yeah, good. Yeah, good job, everybody, and thanks to everybody who attended. That's all.
Colbert,
It's a good meeting, and thanks to the ladies in the office for all the hard work you do. And I missed my opportunity earlier, but I'd like to thank Paul for all the hard work he's done and straightening out that police department and cleaning up the records, all of that. Thank you very much. Bye.
thank you. Campbell,
Yep, same with me. You know, we're gonna definitely miss Paul and his family. So much appreciation to myself, my family, and the community. And thanks. Just one special thanks. That was pretty neat to have Dr. Ann Zink call in like that and just give her time. You know, after a long day, give us full access to her. So that was pretty neat. I think we all got a lot of good information out of that. So appreciate the effort you guys made to set that up, Cassidy. Thank you.
okay, thank you, Paul and your family for being here. It was a pleasure knowing you. Good job. Thank city staff for their hard work and all those things. Next meeting will be held Monday, July 27th, 2020 at 6 p.m. Motion to adjourn, please.
Make a motion to adjourn.
Second.
Second, third.
Thanks, everyone. Good night.
Thanks.
Yeah.
Bye-bye.
Thanks. Good night.
Night.
Thank you, everyone. Good night.